Too uncommon for celebrities to be injured while they're performing on stage. Pink got hurt doing an aerial stunt. Justin Bieber, he hurt his knee in concert. And now Big Boy from Outkast is in bad shape after a dance move right here.
There we go. Ouch.
Lands him on crutches.
So this is why in today's edition of Doc Hollywood, we find out what we can learn from celebs and star athletes who are trying to bounce back after an injury. I'm here with Dr. Jonathan Cooper, an orthopedic surgeon at HealthPartners Clinics. Nice to see you, Dr. Cooper.
Glad to be here.
We're going to talk about Big Boy, 38-year-old Big Boy, rapper from Outkast. Bummer because he destroyed his knee last week after jumping and missing a landing during a live performance. And it sounds like he tore something called his patellar tendon. Am I saying that right? What is it?
That is correct. He tore his patellar tendon, which basically is the tendon that connects your kneecap down to your shin bone. It's basically going to require someone to surgically sew that back to the bone in order to get him walking again.
How about a recovery? You get a surgeon to fix it up. Does it take a while?
It takes a while to recover. He's going to be immobilized for probably about 6 weeks or so, doing a fair amount of therapy, and it's probably going to be at least 8 to 12 weeks before he's back to kind of his routine.
So he's 38. Is this type of injury more common as you get older?
It is going to be more common as you age. In general, that type of injury is most common in our 20s and 30s, and then after we get into our 40s, it often starts to go from below the kneecap to above the kneecap as to where it can be affected.
So it feels like summer hasn't even started yet, but training camp is 2 months away. Hard to believe, but Adrian Peterson had an injury in the off-season for a sports hernia, and he says he's close to 100%. So can you talk a little bit about the difference between a sports hernia and a hernia?
Well, the hernia or inguinal hernia is what most people are more knowledgeable about, and that's where part of our abdominal contents can actually push through the groin area and actually can sometimes be visible or even palpable from a doctor.
Wow.
Whereas a sports hernia is more the muscles as they come down towards our pelvis and where those intertwine with the ligaments and the other tissues right around the groin and the pelvic floor muscles. Those can get strained and pulled, and there's not an actual bulge that can occur with that, but it just generates pain with certain activities.
Are pro athletes the only athletes who tend to get these sports hernias, or how about just your average tennis player, runner, people like that?
Your average athlete can get them as well, but most of the time they're able to recover with conservative treatment and not actually require surgical repair.
And while you're here, we have to check in on Lindsey Vonn. Of course, she's a Minnesota favorite, 28-year-old skier. She really wants to be back skiing for the Olympics in Russia in February, but you'll remember that she had a bad knee injury recently. Can you tell us a little bit about what happened to her knee, and how realistic is it for someone who suffers that type of an injury to get back to being an Olympic athlete?
Yeah, that's going to be the ultimate question, especially when you have an injury that she did where you're tumbling down the hill and you end up tearing 2 ligaments in your knee,
Yikes.
requiring surgical reconstruction of that area of her knee where they reconstructed her ACL and her MCL in that knee. That type of injury is a difficult recovery for an athlete. You got 2 different ligaments that you're working on. The muscles get kind of weak as you're recovering. But fortunately, she came in as a very in-shape person who has very motivated goals behind her, and to get back and compete at an Olympic level is possible for someone like her.
So you'd think for the average person, it's a lesson that the better shape you're in throughout your life, if you are injured, you can bounce back quicker?
It is definitely a benefit to come in better shape, have better basically resources for your body to put towards healing that than if you come in out of shape and get into a deeper hole by the injury.
Thanks so much, Dr. Cooper. We appreciate your time.
Glad to be here.
And you can vote for next week's Doc Hollywood topic. You could win a subscription to People magazine to help keep you up to date with all the celebrity gossip. To enter, text Doc1, Doc2, or Doc3 to 42379 for the topic you want to hear about next week. You can choose from Jennifer Aniston, who gets a procedure called cupping done. She has the marks to prove it on the red carpet. Reese and Demi are swearing by yoga, and will.i.am battles a chronic illness.
And thanks to HealthPartners Clinics and Regents Hospital for sponsoring the show. Remember, check with your physician if you have a health concern.